South Africa on the brink of a COVID-19 third wave. It is said that discussions are underway to see which measures will be introduced to mitigate against this. Meanwhile, the World Health Organization in Africa is pleading with nations that have excess supply of vaccines to donate them to the COVAX facility. This comes as much of the continent's vaccine rollout has been put on hold because of a shortage of vaccines. Acting Deputy Vice-Chancellor for Research and Innovation at the University of KwaZulu-Natal, Professor Mosa Moshabela, joins us now to talk more on this. A very good evening to you, Prof. Good to have you with us once again. Now, the phrase third wave has become quite popular. Everybody talks about it. But perhaps let's try and see what are the measures that will determine whether or not we have officially entered into a third wave.
Good evening to you, to me, and to viewers. I think that, from what we know, the main factor that determines whether we have entered into the third wave really depends on the wave that we last experienced, and this will be the second wave. So we look at the height of that wave where we were seeing about 18,000 cases a day. And we take about 30% of that to basically determine the metric. It's a little bit arbitrary, but basically it helps us when you put the curves on top of each other. It helps us to predict at what point you start to see an acceleration of a wave. And that number is about 5,500 cases a day. So far, we are seeing about 4,000 cases a day, which is quite high. And the reason that number is so high is because the second wave, the peak of the second wave was very high compared to the first wave. If we were using the peak of the first wave, that number will be a little bit lower, which is also why we were sort of calling for the third wave to be called much earlier, so that we don't wait until the numbers are already accelerating too fast before there's an intervention. But in as much as we can see now all the other metrics that basically tell us about the wave going up, including the number of people who are becoming positive after doing the test, which is consistently now about 10% and above that. And also looking at the number of people who become positive per 100,000 population. Even in many of these provinces, we are seeing an uptick in all of them. So we can confidently say that there is definitely an upward trend, but the only difference in calling this is the technical definition. And to some of us epidemiologically, there isn't a lot of difference between 4,000 and 5,000. And it's important then that we take measures to intervene.
That's quite an important definition there, Professor, because as you're saying, it's actually relative to the previous wave that we've had. But what would be the implications of officially declaring a third wave?
Yeah, I think that basically the most important thing is that, declaring a wave is a contentious issue because then oftentimes it results in us having to implement restrictions because right now we know that the most effective intervention we can work with to slow down the infections and protect and save lives, it would be to implement restrictions. But on the other hand, there are concerns that restrictions tend to limit economic growth and economic recovery, which has become a priority in the country. And now we understand that is the case. And so the point at which that is reached needs to be predictable. People need to know, companies, industry, society needs to know at what point we get to that stage where we can implement restrictions so that everyone can be on the same page. If we implement them too early, then we can say that, we are not necessarily maintaining the integrity of our definitions and measures of monitoring restrictions. So I would say that really it's more about achieving social compact around the interventions that we implement in terms of restrictions.
Let's talk, Professor, about the state of South Africa's COVID-19 situation juxtaposed to the state of the rest of the African continent. How do we fare?
Yeah, indeed. I think that South Africa has always had the largest share of cases, more generally, ever since we started. And this was predicted even before we had our first case, largely because of the economic buzz in South Africa, as well as the connectedness of South Africa to so many other countries. So right now we know that the estimation that was given by the WHO is that we're currently sitting with about a third of new cases that are emerging currently in South Africa. And it is a concern, especially because South Africa still predominantly has one of the most aggressive variants, and so which is also highly transmissible. And we have begun to see some other variants, kind of coming in. So in as much as so far we have not seen something that looks like a runaway situation like we've seen in India, there is a concern in the whole continent to say, if this becomes a hold, South Africa can maintain it. But if this starts to affect the rest of the continent, it might actually start to trigger a situation in other countries who may not be able to contain it. So I would say the burden is about a third of new cases, but overall we've got the largest share of infections if we compare to all the cases from the start. But South Africa does really has to contain the spread of infection within its borders in order to prevent spillovers in other countries that may not be able to cope the same way.
Talking about the WHO, Professor, the Regional Director for Africa, Dr. Moeti, said that the continent needs about 20 million doses within the next 6 weeks in order to be able to give second doses of vaccinations for those who have already received vaccinations. Where is the continent likely to be getting these doses? We know that the Serum Institute of India basically withdrew their contribution because of the calamities that they're facing in their own country.
Yeah, I think, Tammy, the problem here is that I think the continent really relied on the supply of AstraZeneca vaccine through the Serum Institute, and which was not a bad strategy. It was a good approach, but South Africa, on the other hand, because of the variant dominant here, we had to abandon it. But the shortage of the supply of the AstraZeneca vaccine has really resulted in a warning for everyone. And it was not just in South Africa, in Africa. It's also in Europe as well, where basically they are now using other vaccines to substitute the second dose. But our hope is that the sort of offer that has come, for example, from the United States can be driven into COVAX and be brought to Africa. And really, I think that it will really, all of this will depend on donations, because even the Johnson & Johnson vaccine, which was supposed to, we were supposed to have a supply of over 300 million for other countries, and hopefully mostly for Africa as a single shot. That has also been delayed. I would say that we would really depend on countries that have spare vaccines to donate to the AU or to donate to the Africa CDC or the COVAX facility.
And your request there is pretty much mirrored by the World Health Organization as well, calling for countries that have access vaccines to donate to COVAX. But what numbers are we talking about here? How many of the countries actually do have access vaccines, and by how much do they have in access?
Yeah, we don't know for sure in terms of what the access is. We know more about what they have in storage, because that depends on their vaccination schedule. At least we know that countries like the US have a lot of access. And I think that they can pretty much on their own afford to give Africa 20 million doses of vaccines that they may not be using. We know that the EU has also now registered Johnson & Johnson. We don't know whether the extent to which they have the supply of Johnson & Johnson that they are going to need to use. But I would say that the US is probably the best shot for Africa in terms of excess doses. Canada has some, but it looks like the US has the largest share.
Well, we are seeing in the United States, incentives being given to citizens or residents to take the vaccine. The access that is presumably in the United States, would that be because they have produced an access number or procured an access number of vaccines, or is it because the number of people that need to be vaccinated would perhaps be lower than the population of that particular country?
Yes, no, we've certainly seen them being offered lots of money to basically vaccinate, to run it, to have a chance to win $1 million at some point in some areas, which is a little bit strange from an African perspective. Anyway, the access basically in the US is after we've accounted for all the population needs that they may have, except now many of them have now shifted the age range. That means that whatever we thought initially might have been access, then they are now vaccinating people up to 12 years old. So that is basically a bit of a problem for those who are waiting for them to release the access. But for the analysis that has been done previously, it was after all the population has been accounted for, including those who had not yet vaccinated.
As far as the meeting between President Cyril Ramaphosa and French President Emmanuel Macron, as far as France giving access to South Africa, how does that bode?
Yeah, I think that for France, it's going to really depend on how soon things can be done. In general, I think when the presidents speak is different from when the ministers start to speak, because then you start to see a little bit more detail in those conversations. I think overall it's a positive thing, but I would say that the main emphasis in that discussion was mostly around the vaccine production, vaccine production initiative, rather than supporting the actual vaccine rollout itself. And in that regard, France will be working closely with Germany to try and support South Africa, and I think it's a good thing. We've already had a number of discussions around how companies like BioVac and so forth could be supported to strengthen manufacturing, and this will be done in order to support the rest of Africa, not just vaccinations for South Africa, but it depends a lot on whether the technology transfer can be affected, which can take a while. So I just think that it bodes well for us long term, but I don't think that it's something that can benefit us in the short term. In the short term, South Africa has to depend on the plan that it is already put in place and inject a sense of urgency in making sure that we can hit the right numbers that we need to cover our population in South Africa.
Professor Moshabela, thank you once again for your time this evening, as well as your insight as we contemplate the excess vaccines that the rest of the world has and the WHO's call for contributions to be made towards COVAX and the third wave that so many are talking about. That's Professor Mosa Moshabela there from the University of KwaZulu-Natal. Do join